Good morning, my name is Valentina González from Parallel A, and today I'm going to talk about Encorafenib, Binimetinib, and Cetuximab in BRAF V600E mutated colorectal cancer. Definition. Colorectal cancer, also as known as a bowel cancer, in the development of cancer from colon or rectum, parts of the large intestine. Some signs and symptoms may include blood in the stool, a change in the bowel movements, weight loss, and feeling tired all the time.
Hi, my name is Jeffrey Meyerhart. I'm a gastrointestinal medical oncologist at the Dana-Farber Cancer Institute in Boston, Massachusetts. I serve as the clinical director of the Gastrointestinal Cancer Center and the deputy clinical research officer of the Dana-Farber. Colon and rectal cancer is the fourth most common cancer diagnosed in the United States. It is probably also the most preventable cancer. We know that we can prevent colon cancer and improve mortality through screening. Those guidelines include checking stool for a blood that can't be seen. It includes doing a sigmoidoscopy or a full colonoscopy, which looks at your entire colon. The most effective screening is a colonoscopy. Most patients who are diagnosed with colon and rectal cancer don't have symptoms, but there are certain signs and symptoms that you should alert your primary care physician or other providers. Those would include bleeding in the stool, abdominal bloating, unexpected weight loss, and if you have blood tests and you're found to be anemic, those are reasons to screen for colon and rectal cancer. If you have these symptoms, it does not mean you have colon or rectal cancer, but it is a reason to alert your physician to be able to look further into your symptoms. Current guidelines suggest patients to start screening at age 50 unless they have certain risk factors. Those would include having a family history, particularly people who have younger family members who were diagnosed with colon cancer, or having a colon or rectal polyp, or having certain diseases like ulcerative colitis or Crohn's disease. The American Cancer Society recently came out with guidelines to suggest that screening should actually start at age 45. The risk is still very low in those under 50, but it is relatively increasing compared to where it was several decades ago.
BRAF. The BRAF V600E mutation occurs in approximately 10% of patients with metastatic colorectal cancer, with a recent estimates ranging from as low as 5% to as high as 21%. Application in medicine, clinical manifestation, there are no symptoms in the majority of patients with early stage colon cancer, and these patients are diagnosed as a result of screening. Although the increased uptake of CRC screening has led to more cases being diagnosed at an asymptomatic stage, most CRC are diagnosed after the onset of symptoms.
So for BRAF mutant, there is a big change, okay, because multiple studies showed that triplet combination with a BRAF inhibitor in the center, with a MEK inhibitor now, before it was also tested with PI3 kinase inhibitors, and an EGF receptor inhibitors, in this case, always Cetuximab, showed very promising results. In refractory patients, response rate over 30%, which is unheard for this disease. Now, recent data showed at World GI showed not only high response rate, but long progression-free and overall survival, which is the reason now the new concepts are that there is a trial being developed in first line. So now, the interesting thing is this triple has no cytotoxics, only target agents, which again indicate when you are smart in identifying the molecular genetics of the tumor, you can successfully interfere and have dramatic clinical effect without a lot of toxicities.
Pros and cons. Pros. A combination of Encorafenib, Cetuximab, and Binimetinib result in significantly longer overall survival and a higher response rate than standard therapy in patients with a metastatic colorectal cancer with a BRAF V600E mutation. The doublet regimen of Encorafenib and Cetuximab also result in significantly longer overall survival and a higher objective response. Cons. Headache, musculatory pain, arthralgia, myalgia occur more frequently in a doublet therapy group than in the triplet therapy. The most common adverse events in the triplet therapy group are gastrointestinal related and skin related events, including diarrhea, nausea, and vomiting. Issue of play in Ecuador. According to Solca's National Register of Tumors, in 2021, there was 203 deaths of colorectal cancer in 2012. Their incidence is rising up in men and women. The estimated rate of incidence is 11.8 cases per 100,000 people. Conclusion. Colorectal cancer, CRC, is a common and lethal disease. Patients with a metastatic colorectal cancer with BRAF V600E mutation have a poor prognostic with a median overall survival 4 to 6 months after failure of initial therapy. A combination of Encorafenib and Cetuximab and Binimetinib resulted in significantly longer overall survival and a higher response rate. Thank you very much.